Implants are very predictable and very successful and should be lifetime restorations, but unfortunately, they can be subject to inflammation just like teeth are subject to inflammation. And as a result, inflammation of the soft tissue and some loss of bone around the implant could be possible. So conditions such as we were discussing with the inflammation and loss of bone around an implant is termed peri-implantitis, meaning inflammation and loss of bone around the implant surface. Now, some of the symptoms may be bleeding upon brushing, perhaps noticing some bleeding when you're flossing, or perhaps changes on the x-ray that your dentist can pick up during an examination. If that's the case, routine cleanings and checkups will help to diagnose any changes in the soft tissue inflammatory state, and routine radiographs on a regular basis to evaluate the bone level will help us to determine whether or not bone changes are occurring around the implant. If that were to occur, we can usually treat that by either controlling the inflammation alone or by grafting some bone where there's some loss of bone around the crestal part of the bone. So around the top of the implant, we can generally clean the implant surface and regenerate that bone to a relatively predictable level. The best way to manage it is not to have it happen to begin with and be followed up on a regular basis.